Cardiovascular disease is still our nation's top killer. Nearly 1 million people a year die from heart attacks alone. And heart disease is something that builds up over time as blood vessels harden and as plaque builds up inside.
And many of these heart attacks could have been prevented if the right steps were taken sooner. The tools of early detection today are so advanced that doctors can look 10 to 15 years into your cardiovascular future.
Cardiologists in the Health Star Alliance specialize not only in treating cardiovascular disease, but in helping you prevent it in the first place. Tom Miller is in Plano at Heart First with an incredible image on screen. Tom?
You see this tiny artery coming down the middle of the heart? If that gets blocked, then you could have a sudden heart attack. And cardiologists will tell you that's often the first sign of heart disease. And that's why we're here at Heart First to talk about the detection and prevention of cardiovascular disease. Meet Health Star Alliance cardiologist, Dr. Jim Rellas.
Let me start by showing you, in terms of a big picture, the heart about the size of a fist, located centered to the left side of the chest. But most people don't realize that the heart has its own arteries. We call them coronary arteries. And they're depicted on red. Next to them are the blue veins that go side by side. But there are 3 coronary arteries. We look at people backwards. This is the right side, just like you're looking at me. So this would be your right coronary artery going down and feeding the bottom part of your heart. We have 2 on the left. One is anterior and it descends to the tip of the heart. So we call it the left anterior descending. Patients know LAD if they've had a problem or a stent. And the third one circles around the back of the heart. We call it the circumflex. This is where you have heart attacks.
Try not to look down at the thing. Look at the beautiful walk in the woods you're about to take.
Okay.
You might think that a stress test like this is the best way to learn if you have potential blockage, but stress tests are far from perfect.
To pick up an abnormality on a stress test, you need a blockage that is 70% or more. I like the example of the pipes in your sink at home. You know there's hair and dirt building up, but until the water flow stops or slows down, you really don't know it's important or significant. Well, the same with our arteries. Any flow dynamics will show you that until you get to about a 70% blockage, you won't disturb the blood flow, and we won't pick it up on a stress test. So all we're telling the patient is they are not down here in the end of the buildup of cholesterol. They're not over 70%. They don't need a stent or bypass, which is great. But what you're asking me is, where are they over here? You want to know, are you truly normal? Do you have a little bit of cholesterol? Or is there a lot going on? Are you the next Tim Russer, who has a lot of plaque in there that could rupture and cause a heart attack?
Did you catch that? Stress tests are effective if you have a 70% blockage. But what if you could have eyes into your heart's arteries now to see whether you're at risk of developing this deadly plaque before it gets to 70%, while it could still be easily reversed and without surgery? Well, that technology is available, and it's called a CTA.
CTA stands for coronary arteriogram. So this is an injection, but it's in the office, and we're going to take pictures over 1 minute. Actually 10 to 15 seconds of pictures, but you're under the machine for less than a minute. With that, we can then look at the arteries themselves, not only see the hard plaque, but we can see the soft plaque, which is the dangerous plaque. This is the best test to rule out a blockage that will, in the near future, cause a problem.
Stress tests have a high error or miss rate, but CTAs, on the other hand...
With the CTA, I won't miss any patient. Literally 99 of 100 we will pick up as having a significant blockage. But the other thing is, if you remember the artery we looked at, I will not only tell you that you don't have a significant blockage, I will tell you exactly what you have in the arteries, if anything. So you then have a good feel for, let's pretend you're 50 years of age, with your risk factors and stress and everything you've eaten and worked out or not. Well, at 50 years of age, with one test, and this is nothing we need to repeat on a frequent basis at all. So at 50 years of age, we can then say, all right, my heart is at this point, and hopefully I'm going to live another 50 years, and now I know what I need to do to make it to 100.
Cardiologists have so many tools available at their disposal now to look into your heart's future 10 to 15 years down the road. And they have so many effective medications. Please talk to your physician today about what you should be doing for your heart.
Thanks, Tom. According to the American Heart Association, there are 7 factors that you can do something about now to help your heart. They are: stop smoking, get active, adjust your diet, reduce stress and alcohol consumption, and maintain your blood pressure and cholesterol at recommended levels.
And your Health Star Alliance primary care physician can help you get started. They'll oversee your progress to a healthier heart. Tell your doctor that you want to get serious about preventing heart disease, and they'll guide you from there. For more information on preventing heart disease, visit the Health Star Alliance website at www.healthstaralliance.com.